Good afternoon. This is St. Clair County Health Department Facebook Live this week, and you have the B team here in place of Dr. Annette Mercantant, who is on a well-deserved vacation. I am Liz King. I am the Nursing and Community Health Director.
And I am Rebecca Campau. I'm the Nursing Supervisor of the Preventative Health and Immunization Departments.
So I think we're going to go over the data for this week first. All right, everything's up there for you to see. So this is what we look at every week. You see our total cases are at 18,935. Our hospitalizations are up again at 798. Deaths 430, and then you see our recovered rates as well. In the green in the middle, you see the changes over the last 7 days. New cases were 133. And then the average new cases per day were 19. Our percent of positive tests were up at 5.3%. I think we'll switch to the next slide. This graph, for those of you who watch every week, this is our 7-day average of new cases. What should I say? Oh, they flipped it on me. We're hoping for a plateau is what Brandon tells us a little bit there. If you look at it closely, then next, we have the St. Clair County COVID-19 vaccine data. Again, this is first and second doses. We've administered to St. Clair County residents 128,924 doses of vaccine. That puts us at a vaccine coverage rate for St. Clair County residents 12 and older at 51.9%. And then doing much better is our 65 and older residents at 76.9%. This is our COVID-19 vaccine coverage by census tract for first doses. It kind of pulls out that Port Huron area there and enlarges it. I guess what we can say about this is there's still some areas of the county that we're working on that have some work to do to get those first doses in. We're watching those closely. Next is just our dashboard. The link you'll see right there, and that's where you can get all the information as you log on with the numbers that I've already went over. Okay, I think we can move on to some questions.
Okay, I just wanted to let everybody know watching today that we are going to be ending our show today at 4 p.m. So if we don't get to your questions, we will have you email those to us at covid19@stclaircounty.org. And we can either email you back or we can address them next week. Okay, let's get started. We had a lot of questions come in last night, and then we have some so far today, so we will cover the ones that have come in already. Okay, we'll start with you, Liz.
All right.
First question. Are you, and this also was asked today, are you going to mandate masks for kids under 12 in all indoor schools since they can't be vaccinated?
Well, there are no mandates right now, but we strongly recommend and encourage schools to enforce masking policy.
Okay. Rebecca, if my child is exposed at school, but he's vaccinated, will he have to quarantine for 10 days?
Quarantine is not recommended or mandated for those who are fully vaccinated at this time, unless they do become symptomatic. Then they would hopefully be tested and isolate.
Okay. Liz, how many people who have been vaccinated have contracted COVID-19 locally?
So since, I guess, January, so this year, we have had about approximately 150 breakthrough cases of disease, but that's out of over 18,000 cases when you look at that. Statewide, those numbers are very small, so they're hard to put together. But statewide, we know that 97.8% of new COVID cases are in unvaccinated individuals.
Thank you. Rebecca, can you review the guidelines for testing after exposure and the steps we should take if we have symptoms? I'm vaccinated, and thank you for the wonderful job you do to keep us all safe.
Oh, thank you. And that is a good question. So if you have been COVID exposed, then quarantining for 10 to 14 days is recommended at this point. And as far as testing, if you have a symptom goes, definitely seek out testing. I know we offer testing here at the St. Clair County Health Department, and there are other testing resources listed on our website.
Thank you. Liz, there was
Mhm.
we paraphrased this question, was kind of long, but there was a lockdown at a local senior facility recently because an employee tested positive and infected a patient. The lockdown was extended and I'm unsure why. Was there another patient or employee that got sick? Do they require all employees have their shots?
Okay, so a lot of questions in there, but first off, if you're looking for cases that are reported in our long-term care facility, you can find that at michigan.org/coronavirus. And then secondly, businesses can have their own policies on vaccination for their employees and different mandates. So I guess we'd recommend you go back to that facility and question what their policy is for their staff on COVID vaccine.
I just want to make one slight correction, Liz. The website for the long-term care facilities is michigan.gov/coronavirus. You had said michigan.org, so I just want to let everybody know.
Oh, thank you.
No problem. Okay, Rebecca, do you know when they will be giving out the boosters for 65 plus, and how will they be scheduling?
So when the booster doses become available, we will put information out, I'm sure, through our social media channels. Right now, we are still waiting on more guidance from the CDC and MDHHS, but it looks like possibly around September 20th, those booster doses will be available. As far as rolling them out through St. Clair County, we are expecting booster doses to be readily available through cooperation and partnership with our local pharmacies, local physicians, as well as here through St. Clair County Health Department. And really, vaccines right now are in ample supply, so we don't anticipate there being the shortage and the difficulties that there were at the beginning of COVID vaccines.
Thank you. Liz, is there any news on when the FDA will be giving full approval on the vaccine?
Well, nothing out yet officially, but what we're hearing is that end of summer, beginning of fall, that we'll hear something officially come down.
All right. Rebecca, for booster shots, are they recommending that you get a different brand than the initial vaccination? So if you originally got Moderna, are they recommending Pfizer or Johnson & Johnson, or does it matter?
So again, for the booster doses, we are still waiting on guidance from, ACIP, FDA, CDC, and then through MDHHS. So I do not have information on that. For the additional dose that is currently being recommended for the severely immune compromised individuals, they are recommending the Moderna third dose if you received Moderna initially, as well as Pfizer third dose if you received Pfizer initially.
Okay. Liz, will schools be tracking who is masked and who is not, who is vaccinated and who is not? Will isolation policies vary depending on vaccination status?
Um, that's a question, I guess, for schools. So I'm not aware of them tracking who's masked and who's not. So I guess we'd refer you back to your school on that. And then as far as tracking who's vaccinated, who's not, that's something we know here at the health department that we could verify by going into MICR. And what was the second part of the question? I'm sorry.
If a fully vaccinated individual develops symptoms, will isolation policies vary depending on vaccination status? Sorry.
Not isolation policies. No. So if you're vaccinated and you develop symptoms and are tested positive for COVID, you'll still isolate those 10 days. But quarantine policies are different. And I think we just touched on that if you are vaccinated and you're a close contact of a case, you will not have to quarantine.
Okay.
So I wasn't sure if they meant isolation or quarantine in that question exactly.
Yeah, they said isolation policies.
Okay, so isolation is when you're a case of COVID. So if you're vaccinated, there's no difference in isolation. No, and you have a positive case.
All right. Rebecca, if someone had to take steroids for 14 days after 4.5 months of being fully vaccinated, should that person get a booster?
So 14-day course of steroids would be what's considered a short-term use of oral steroids. I would imagine that's what they would be taking. And so that would not be an indication for a booster dose. The steroid component of the guidance for those immune-compromised people would be individuals who are on long-term steroid use with like an equivalent dose to 20 milligrams of prednisone per day or greater. Some other guidelines under that would include those who are severely immunocompromised, so anyone who's undergoing cancer treatment, who has had an organ transplant and is on anti-rejection medication, individuals who might be on a biologic medication for an autoimmune disease or other reason, those that have received a stem cell transplant within the last 2 years, and other individuals that physician, has been following their course and deems them, moderately to severe immune compromised at this point.
Thank you. I think there's some confusion out there between the terms additional or third shot and booster. So right now, it's like Rebecca just said, it's the moderate to severely immunocompromised people that are eligible and recommended for a third dose or an additional shot. Booster yet to come, like she said. Okay, Liz, this is back to the maps.
Okay.
Is Birchville in the red?
I think what's meant by that is that all of St. Clair County has moved to substantial at this point, and that means you're red, right, Brandon? I'm looking at Brandon. Orange, substantial. Nothing. Is there something different in Birchville? No, nothing different in Birchville.
Okay. All right. Rebecca, what type of test is being used in St. Clair County? Is there a lab in the county that can actually detect the various variants?
Oh, that's another great question. So in St. Clair County, we have both PCR testing as well as antigen testing. We do not have any local labs that would detect variant strains. What happens with those is they are sent either to our state lab or commercial labs, and genome sequencing is ran, and that's how they determine what variant the virus is.
Okay. Liz, and this is the last question that came in from last night, then we'll move to the live. How long do you believe that folks who have antibodies for after a COVID infection?
When you recover from COVID, there is some antibodies that exist after you've had the disease, but what we know is that it starts to wane after 3 months. And so best protection is vaccine and being vaccinated.
All right. Okay, we're going to move now to the live.
All right.
So this question could be for either Rebecca or Liz. As a family without spleens, is it safe to send my high school student to in-person school? He will be wearing a mask.
Well, I guess I will start that question by saying, if the individual is vaccinated and masked, there is still a risk with an asplenic person just because their immune system is more compromised. However, vaccine, of course, does provide that initial layer of defense against COVID, as well as masking, of course, then provides a second layer of defense.
Okay. This is from Dwight. Thank you, Liz, Rebecca, and all your staff for your hard work and dedication to this community.
Hi, Dwight.
Thank you, Dwight.
Thanks, Dwight.
Yeah, thanks, Dwight.
Okay, this is from, actually, Lauren had answered that already. Janet says, hello, Rebecca.
Hi.
Hold on. I'm just making sure that. Okay, this is from Sue. How many vaccinated people do we have that are positive with COVID?
Okay.
Do we know that?
Hold on. So August data from Brandon here, who's spoon feeding me our information. Thank you. 24 people in August, which is 8% of total cases so
Okay.
far.
This is from Jonathan. Again, this is a Brandon question. Out of all the COVID deaths in St. Clair County, do you know how many actually died from COVID and not underlying conditions?
430 people is what Brandon says.
Okay. The next question is, from Lisa, are vaccinated individuals who test positive counted in the active numbers? I have been told by medical staff they are not.
Yeah,
Yes.
they are counted in the COVID totals.
Yeah,
Okay.
absolutely.
This is from LC. How many people in our county have had adverse effects from the vaccine or have died? Do we know that?
Right. Right. So no one has died from adverse effects from the vaccine, and very, very few reports of adverse events after the vaccine's been administered. Rebecca was at probably almost every one of our COVID clinics, so she knows firsthand the number of times we had to fill out just an incident report or something like that. Minimal. We kind of keep track here. I don't have those numbers right away, but Rebecca, maybe you know a little more detail on even a severe event.
Yeah, off the top of my head, like immediately post-vaccine, I can think of two individuals in which we did have to administer epinephrine to for an anaphylactic type reaction, and that's generally related to a vaccine component. So not necessarily, anything that is, under our control. And then otherwise, there were a few others that we had in the medical monitoring area that maybe had some
Yes.
vertigo or, anxiety and just needed to lie down for a few moments post-vaccine. But
But compared
otherwise,
to
no
the number of
severe.
vaccines
Yeah.
we have administered, very few.
All right. This is from Sue. Do they test every positive case for the variants?
Well, they is a no, not every case. Here
So
we do.
yeah, so any positive case that we do test here at St. Clair County Health Department, we are sending them to either our commercial lab or the Bureau of Labs through MDHHS for genome sequencing. Other specimens that do go in, I did hear that about 90% of those from outside facilities are being sequenced for variants.
Okay. The next question is from Cassandra. Do you have the numbers on reinfection rates in the county? Are you tracking breakthrough cases that aren't hospitalizations or death? Again, Brandon.
So I think we already talked about breakthrough cases, right? But reinfection, Brandon? I didn't hear you. It started to be. Okay. So Brandon reports that we are still working on the data, but it's about 150 to 160 individuals, the reinfection rates. So if we're doing the investigation, we do know that. I mean, we are looking for that. We are asking for that information if we get it.
And then I guess the second part of that, the breakthrough cases, we do track that on a local level, and the state does track that data as well.
Okay.
Right. So
This
we're
is from,
informed of
go
breakthrough
ahead.
numbers and cases. Sorry, Jen, go ahead.
Oh, no, that's okay. Didn't mean to cut you off there. All right. The next question is from Lori. She asked, what are your thoughts about large group indoor gatherings in the fall?
So
These are touchy questions when they ask for our
yeah,
thoughts.
because I mean, personally, I think still, and especially with the prevalence of Delta variant increasing, daily, really, we are getting more cases of Delta variant here in St. Clair County. And we do know it has a higher viral load, making it more transmissible. So,
I
if
would
all
say, go ahead.
individuals, if all individuals were fully vaccinated, that would, of course, make an indoor gathering a little safer. But personally, I would be hesitant of any large indoor gathering.
Right, right. That's what I was going to say is Dr. Mercaton always refers back to risk. And I would say you have to measure, the level of risk yourself, your health, your vaccination status. What does that event really look like? Are there other mitigation measures? Is there masks? Those kind of things.
Okay, the next question is from Martine. I'm sorry if I said that wrong. How high does community spread have to be for the health department to mandate masks in the schools? Is contact tracing, isolation, and quarantine going to apply for this school year? We had already mentioned that right now there is
Right.
no mask mandate. So maybe you want to address that second part.
hmm So contact tracing, isolation, and quarantine going to apply for this school year? Yes. Yes, we have been doing contact tracing, isolation, quarantine, um, the whole entire time of COVID. So yeah, these are going to be done this year as well.
Okay. Cassandra asked, I don't know if I just asked you this or not, but she questioned 160 reinfection cases since the beginning of the pandemic. Is that correct?
Yes, Brandon says very provisional, but yes, that's what I was referring to, Cassandra.
Okay, you sort of already covered this before, but since we have some time, this is from Mary. When will the boosters be available for our area seniors or those who have asthma, diabetes, and such? Sorry if it was already asked.
Yeah, so just to cover that again, right now we're still waiting on further guidance from, ACIP, CDC, and MDHHS, but it's looking like September 20th, around that time, will be when booster doses are available for those individuals.
Okay, and our last question that I have so far for the live is from LC. Excuse me, there's two more. From LC, the insert for the COVID vaccines say intentionally blank. Can you tell us the ingredients that go into the vaccines?
Yeah, so the insert in the COVID vaccines is left intentionally blank as a filler in the box because the COVID vaccines, the mRNA vaccines specifically, are very fragile, and there's like a small gap between the top of the vials and the bottom of the box lid, I suppose. So it's left there really as a padding so the vials aren't jiggling around during transport. And as far as vaccine ingredients, on the manufacturer's website, you can find the information. It's also located in the emergency use authorization fact sheets, where you'll get like a more specific breakdown, I guess, of what is in there, because some of them are like the long scientific type words that I'm sure I would butcher on this live. So that's going to be the best
Okay.
resources to just either go to Moderna or Pfizer website, or even just Google search, emergency use authorization for Pfizer or Moderna or Johnson & Johnson vaccine, and you'll find that information there.
All right. And the last questions I have today are from Lindsay. And if we can answer this or not, will there be a homecoming dance allowed
Aw.
this year for high school students, or will it be up to the school?
So that will
We don't
likely
have an
be up
answer
to the
to that.
school.
Yeah,
Yeah.
right.
Okay.
It's
And
a good
it's three.
question. I guess it's good to know that what everybody's thinking about. So
Yeah.
Okay. Well, it's 3:54 and we have two more questions. And then,
okay.
as I mentioned at the beginning of the show, we have to end today at 4 o'clock. So send your questions to COVID-19 at stclaircounty.org if we did not capture those today. And we'll be back next week as well. This is from Christy. How low, do county numbers need to be before contact tracing is not used in school?
Hmm. Well, it's not about the numbers. Contact tracing, those kind of things. We've been doing contact tracing since there was one case. It's not about the numbers or the rates that are going on at this point. Rebecca,
Yeah, I mean, it's
anything
really,
different?
yeah, I was just going to add, I guess it's really a mitigation strategy to help
Mhm.
decrease the spread. So, I mean, I guess until COVID is, either eradicated or not spreading at such the rate that it is right now, we will still continue to utilize contact tracing as one of our best defenses in slowing the spread or stopping the spread.
Okay, and that's all the questions we have for today. It's 3:55, so we will say goodbye. Thank you very much, Liz and Rebecca, for being a guest host today, and for Brandon as well, who is our data specialist, informatics coordinator, and everyone else behind the scenes. So we will see you again, Liz and Rebecca, next Thursday at 3:30. Thank you, everyone.
Thank you.
Bye, thanks.